Hi, thank you guys so much for having me. I'm Sean, as you just saw, and I'm a patient with Crohn's disease. I was diagnosed at age 12, and since then I've been on a 13-year-long journey trying 100 different diets, treatments, alternative therapies, and medications to try to make myself well. And I had a revelation at one point that silo of information that I was building up through all these different treatments and was in my head was something that 1.5 million other patients with Crohn's and colitis throughout the United States also had, and that there should be a way to share all that information with each other. So what I did is, after accumulating lots of knowledge about how to heal myself, I went on a quest to meet as many other patients as I could so I could continue to learn from them and share what I had learned with them. So I started a meetup group in San Francisco for people with Crohn's and colitis. I became a camp counselor at 2 different camps for those kids as well. Not only did this make me feel the most connected that I've ever felt in my life, but it also gave me access to this incredible vast sea of resources, these patients as all resources in my health. So whenever I had a question, I could ask any of these patients if I just remembered which treatment they had taken, right? Which wasn't easy when you know 300 patients. So as a software developer and designer, I decided there must be a solution that I could create to help share what I had created with all these other patients, and that is crohnology. So I built a website that allows patients with Crohn's and colitis to share their profiles in a way that's not medical, it's not intimidating, and it feels natural and treats you like a person. So a newly diagnosed person with Crohn's or colitis now can go to this website and immediately see other patients near them. And like I said, these are resources to them. So they can click on the profile of that patient near them, and wow, you can see right away information about Susan, and you can see that her health is doing well. She sets her health with a simple health slider, which really just takes a click. And that sends out ripples of social engagement throughout the site because everyone gets to see how her health is doing. You can also see that she's taken Remicade. So I can click on Remicade and dive in and see other current users and past users. I can also, from that data set, simply ask a question to these users. And this is something that you would not be able to do in a forum, right? You could ask a question in a forum, but you have no guarantee of who answers that question or no way to validate who they are. And in this situation, this question that you would ask would be emailed directly out to all these other patients. As a result of people rating their treatments, I can show which are the most effective treatments in ranked order. And in addition to people showing me what their current health is in real time on a day-to-day basis, I can actually show what the current average health of users that are taking a treatment is. So it actually gives real-time information about that treatment. This applies equally as well for supplements as it does for prescription medications. And you get easy access to a dashboard to oversee the friends, the people that you care about, so you know when their health drops, you should send them a line and help them out. You know, Crohn's and colitis, they're hidden illnesses, right? How am I doing right now, right? You can't evaluate that. So this gives patients an accessible way to share that information in a low-touch way with their friends. Why do I think this is working? What are the reasons that I think that this is working so well? Because engagement is working really well in this private beta. I think one is simple and it's fun. It doesn't feel medical, like I said. And another is based on real relationships. So people in my meetup group for people with Crohn's and colitis, they know each other by their real names. They know each other by their faces, right? And they know each other by their locations, right? So these are things that help validate that information and help you feel connected with people. And I do things such as networks of trust and network-based privacy to help alleviate privacy concerns. So here's some of the things that people tweeted recently when a blog post that I wrote went viral. I'm so impressed, this will be life-changing for our people. There's 2 nuggets in that are great, life-changing and our people, right? And then lastly, my grandfather had Crohn's. I wish he was still alive today to see this. Those things touched me very deeply and let me know that I was building something that people love. Thank you guys so much for letting me share.